Welcome to the COMC Community Spotlight Show, of course presented by the great folks at COMC, Central Ozarks Medical Center, where your health is their mission. And as luck would have it, we've got one of the great people from COMC with us today. It's Desirae Kelley. How are you?
Good, how are you?
Excellent. You came all the way from Richland to join us here. Community Health Worker Supervisor. That's your title.
Yep.
Whole lot of words there. Community Health Worker Supervisor. What is a Community Health Worker Supervisor?
So it's kind of new. So basically I supervise our CHW team, help with their time, payroll with all that. And then on the side, I still, I manage doing all like the weekly reports for CHWs, our numbers, our quarterly reports, our yearly reports now. And then on the side of that, I'm still a community health worker. So I still help with the community health worker side of things also.
Okay, so boy, it sounds like you get stuck behind the desk a lot then,
I do, but I'm out in the community a lot though also, which is nice. Yeah.
So you just throw out CHW, you guys talk in your own vernacular. That's community health worker.
Yep. So it's just shorter because, if you say community health worker, it's very long.
It takes
and
a while.
A lot of us just say CHW. So yeah, that means community health worker.
Okay. And I noticed you've got a whole lot of letters behind your title, which usually means you went to school for a long time.
Not too long, but there was a couple certificates and licensings and stuff that we had.
Which is pretty important in what you do.
Oh yeah.
I'm guessing, right?
Yes.
Okay, so you got a C and a CAC and a CPST. What do those mean?
So we all go through a CHW class, so a community health worker class. And then once you get that certificate, you become credentialed. So there's that C that is added on to that.
Okay.
So now we're all the CHWs that come through COMC, we all get certified that way. And then we're either CACs, which is certified application counselors or navigators in the state of Missouri. So we have to get our insurance license so we can help with like marketplace applications. And you have to have your insurance for that. So you got to have the insurance license. And then, so with the CPST, we are actually all certified passenger safety training. We went through the class. So if someone comes in that needs help with their car seat, or if they're transitioning into like a booster seat, we are able to help with that. So like when we do our health fairs, we try to sponsor that where we go in and we're like, hey, do you have a car seat that you want to make sure that it's in right?
Right.
When we took the class, I have two little, so I was like, I'm gonna go in here and it's gonna be great and I'm gonna know what I'm doing. And it was a whole different ball game. I learned so much. I feel like I had my kids in wrong.
Yeah.
And so we did all learn. We all went through the 3-day class and it was hard. I have to say it was a very hard class, which I am glad it was because we all got the knowledge now on how to put in actual car seats the correct way.
Yeah.
And so it kind of just opened I think our eyes in a whole different view on how to actually put car seats in.
Oh, I remember those days, and those things were hard to do.
Oh, yeah.
I mean, so, just strap it in with a belt or something, right?
Yeah.
But that's not really the right way to do it. But that's the dad way to do it.
Yes.
But, and you don't think about those little things, which can turn out to be pretty important.
Yes.
Life and death sometimes.
Oh, yeah, for sure.
So you're a community health worker. Is this like a passion that you've had all of your life, or how do you get into that? How do you get that?
So it wasn't like a passion of that it is now.
Okay.
When I actually applied for it, I really didn't know like the ins and outs of it. I just know it was something with healthcare and I wanted to get back into that. When I had graduated high school, I actually graduated with my CNA certificate also. So I was already with like this nursing stuff.
Okay.
So I figured, in nursing, like let me go for the nursing field. And then it really didn't turn out the way I really wanted it.
Kind of not what you thought it was going to be.
Yeah, and I was like, I don't think this is for me. So I kind of did a couple other things. And then I just wanted something different where I could help the community. And I seen it and I was like, I'm gonna go for it. And I applied and I got it and I have not looked back since.
Wow. Well, I would guess from COMC's perspective, you'd be perfect because you've got the nursing credentials, but nursing wasn't for you and this is for you. And so you kind of the best of both worlds there.
Yeah, definitely.
That's kind of neat.
Yeah, it is.
So nursing is hard. I mean, hard and dirty. I've got a couple of nurses in the family, a male and female. And you talk to them about what they have to do. That's not an easy job.
No.
Wow.
No.
So you like this a lot more.
Oh, I love it.
Community health worker. Okay,
Yes.
so you kind of had to do a little life before you figured out what you wanted to do. And it's really worked out well for you because you won some big, huge award recently.
I did, actually.
What is that?
So in March, I had won the CHW award. It's through Missouri, the rural actually.
The rural, yeah.
So there's an urban one that they had and then a rural.
Okay.
The past couple of years, they've only just had it wasn't just based off of rural or urban, so I'm glad that they separated it because a lot of them, it was almost like all the rural, not the rural, but the urban CHWs would get it.
Yeah.
And so I had actually won the rural one, which was really awesome because I really didn't expect it.
Yeah.
They had a category of, I think it was 16 other rural CHWs, so I was up against 16 others.
Dang.
And I won it, and yeah, it was a complete shock.
Wow.
So it was really cool to bring that, and what an honor it was.
That's the best kind of shock,
yes.
right? One
oh
of
yeah.
those.
I still don't feel like it's real, but it is.
That is so amazing.
So yeah.
But it's good that they separated it because, it's a completely different world. When you're working in an urban environment and in a rural environment,
Oh yeah.
totally different set of rules.
Definitely.
People, all that good stuff.
Oh, yeah.
Okay. So we're talking with Desirae Kelley, Community Health Worker Supervisor at COMC, and we'll continue to talk with her. She's from Richland, a hunter, animal lover, all those stuff. We'll get into that as well when we come back on the COMC Community Spotlight Show. At COMC, your health is our mission. Central Ozarks Medical Center offers 3 OBGYNs at the Osage Beach Clinic and 2 pediatricians with same-day appointments available. At COMC, our doors are open to everyone with 5 primary care locations conveniently located across the Ozarks. COMC for the best medical, dental, and behavioral health care. Get more info on how COMC can help you at centralozarks.org. COMC, where your health is our mission.
You're watching Lake TV.
Welcome back to the COMC Community Spotlight Show. We've got COMC's Desirae Kelley with us, Community Health Worker Supervisor. So you get the best of both worlds. You kind of get out, you're in the community talking with the folks, but then you got to sit behind the desk and do all the reports and do all that too. So in our community, we have a pretty big rural population, so it's pretty important what you do. What do you do to help serve the rural community at COMC?
So what we do is all the CHWs that we have 7 CHWs, about to be 8 of them. What we do is we can offer Medicaid applications, so we'll do applications with people.
Okay, that's a big deal.
Yes, it is. It's very, very big, especially back in 2022 when Missouri passed the Medicaid expansion. So our population with Medicaid kind of got bigger because of that, which is great because it helps so many more Missourians get the healthcare that they actually need. And so we do Medicaid applications, we do marketplace applications, which marketplace, a lot of people don't really know what it is. It's from the Affordable Care Act.
Right.
So if you don't qualify for Medicaid, but you don't want to go through like the big insurance companies that you're gonna pay real big out of pocket for.
Right.
You can also do the marketplace. And so the marketplace has different plans for, certain affordable. I've seen, premiums from $4 a month to $300. So, it really just depends like how many's in your family, household income guidelines, that kind of thing. And then we can also offer, we do SNAP applications.
Okay.
Which is food stamps.
That's the food stuff, yeah.
Yep, we can do that. And then we can also, help with any type of resource that, that we may know, or we will expand those resources to where if we need to reach out to a certain partner with those help, resources come a long way. So we kind of wear many hats at COMC, and it is awesome.
A lot of knowledge of all the different things and what's inside of all the different things and stuff. That's pretty cool though, because the normal regular Joe, we don't know anything about that.
No.
Right? And we need the help.
Yes.
Which is what you're there to do. I hear you married your high school sweetheart.
I did.
Really?
Yeah. Yep.
And it actually worked out.
Yeah, it actually worked out.
That's amazing.
Yep.
Right.
Yep.
So you've known each other since high school or even before?
Well, we knew each other a little bit before because we're small towns,
Right.
So he went to a different high school than I did, but eventually, we we knew each other from there.
Right.
And so, yeah, we got together our junior year, and it stayed since.
Wow, and you've got some littles.
Yes, we do. We got
right?
2.
Wow. How sweet is that?
Yeah, it's awesome.
And like you said, you live in the rural area, so you like to get your kids up close, personal with animals and stuff like that.
Yes.
What is the positive of that? What does that do?
I think it gives them a sense of like responsibility.
Okay.
You know, they help me feed, which is nice. You know, extra hands, sometimes it can be a little crazy, but it's time for me to slow down, and, you know, they can help assist, and they love doing it. Yeah. We have chickens, so they help feed that and collect the eggs. Yeah, so they just help, and I think it just gives them a responsibility at a young age, and, you know, just to love and care for animals.
Yeah. Well, and it's funny because I was reading in your bio, you're an animal lover, obviously. You're also a hunter, right? And some people don't think those go together, but they do go together. Yeah. How do they go together?
Well, I think too is, you know, I love deer hunting. I grew up that way. Both my parents, my brother, we've all just hunted. Yeah. And so it kind of I grew up that way. And I think too is like to understand, you know, deer hunting, a lot of people think it's cruel, but at the same time, like you got to keep those numbers down because disease happens. And so, you know, I may be a deer hunter, but I'm also putting food on on my dinner table for my family. And so I think they definitely go side by side with each other.
Yeah, I do too. It's definitely a positive. And they will tell you, you've got to help thin the herds or they will just die out anyway. So that kind of good. Okay, so back to the healthcare stuff. One of the big new advancements, I guess, is telecare, right? What is telecare? How does that work?
So telehealth more so, there's different sayings. Right now what we call is telehealth. So when I got hired on, I was actually hired on for a CHW, but also a school-based telehealth coordinator. Okay. So with that being said, it's kind of like my baby with things. We started with only 2 schools that had it, and now we have 7. So we have branched out, and I'm hoping to keep making strides in more schools. Right. So with that being said, with the telehealth in the schools, let's just say Johnny's at school in the nurse's office a couple times that day saying he has a sore throat. Right. Nurse will call me saying, hey, Johnny has a sore throat. I have some testing strips. We provide the testing strips for like flu and strep. So she's like, can I go ahead and test him? And I'm like, yeah, I'll get him on the schedule with one of our providers. Yeah. So she goes ahead and tests him. I get an appointment set up with one of our providers. We have a couple that do the telehealth. And it comes with a little screen, like a tablet, and it has an otoscope and a couple other instruments. So you can look down the throat, ears. We've seen everything. Wow. Bug bites, spider bites, pink eye. Everything. Yeah. So it can go everywhere. And with that is they can be seen in the school nurse's office and with one of our providers. And it's just it's fast and convenient because it's not taking them away from class for too long, because most of the visits take maybe 5 minutes, if that. Some of our nurses are really quick with it. So, it can take a matter of a couple minutes and then they're done. And so if they get tested and they pop up saying it's positive, really we get they have to fill out a form, registration form saying it's okay. And we obviously get with the parent to say, hey, can we do a telehealth on the kiddo? And a lot of times they already sign it, so they're like, yes, please. Yeah. And then within that time frame, if they are positive, the provider will send in prescriptions, antibiotics, whatever it may be. And then we notify the parent or the guardian, and we let them know, hey, Johnny tested positive for strep. Can you come get him? Because, he is kind of contagious. Yeah. And with that, it cuts down like parents having to leave work, if they're not contagious. And if they are, then all they have to do is go pick up the prescription, come pick up little Johnny. Right. And then they can go home and relax and get on the mends.
Kind of makes life a whole lot
does.
Easier.
Yes.
And that's one of the areas where new technologies really help things in that area. Okay, so we're out of time, but if folks want to get more information about you, and the health workers, community health workers, or COMC, where do they go?
So you can go online and you can call us, and then you can also call me at 573-723-1197. Okay,
and the main website is centralozarks.org. Yep. Excellent. Yep. So it's Desirae Kelley. Amazing stuff you've got going at COMC. Thank you so much for coming by.
So
appreciate it.
Thank you.
And thank you for joining us for COMC's Community Spotlight Show.